I am Dr. Susan Boolbol, and in honor of Breast Cancer Awareness Month, we are kicking off our weekly series for Nuvance Health. Today, we have the honor of having Vicki Barber, who is a registered dietitian and oncology nutrition specialist at Nuvance Health. As I said, I'm Dr. Susan Boolbol. I am the system chief for breast surgical oncology and the breast program. Vicki, just to start, what is the most common question you get when a woman with breast cancer is sitting in front of you?
Well, good afternoon. Thank you for having me. I think it's probably not so much a question as it is a statement. When I generally am meeting a patient for the first time, it may be when they're beginning their treatment. And one of the probably broadest statements, but most common, is I want to try to eat healthy during my treatment because I want to be as strong as possible for my treatment. And with that being said, of course, we want patients to tolerate their treatment and feel good about themselves and also stay healthy through their treatment. So I don't know that it's so much a question as a general statement. And then it's followed up by a question like, well, how do I do that? I think that's a very individual answer when it comes to that question, because every patient is in a different place with their eating and their lifestyle.
Without a doubt. And I think that one of the things that we want to get across is this is lifestyle. There's very few things in our control with breast cancer or decreasing our risk of breast cancer, but our weight is one of those. So especially for postmenopausal women, being overweight increases our risk of breast cancer. So that is an enormous issue for a very large percentage of our population. And one of the questions is, how do we control that? So for postmenopausal women, losing weight is no easy feat. So I get the question, well, I just have to cut down calories. Is it really that simple? Is it just about calories, or are all calories different? If I eat 200 calories of ice cream, is that the same thing of eating 200 calories of roasted vegetables, or is it choices?
Right. I think it's probably a little bit of both. So when I often get that question, how am I going to lose, 30 pounds or 40 pounds or 50 pounds? Oftentimes I start off with, well, let's see what you're doing now diet-wise. Are you eating fast food 3 times a week? And are you, buying food for, at lunch at your job on the go? Is there any meal planning or prep involved? And, that may be a good starting point rather than looking at a steep goal of, I have to lose 30 pounds. Yes, that's a number, and we look at BMI and say, this is a desirable number. But I also think that it really depends on where the person is within their treatment, within their recovery, and what their life has been like prior to a cancer diagnosis. Were they always overweight? Did they always struggle with that? Were they, thinner earlier on, had children, and then gained weight? So I think there's a spectrum of, how to kind of conquer that dilemma or that issue for each patient. In terms of caloric intake, in a sense, calories in, calories out do generate either a weight loss or a weight gain. However, not all calories are created equal. When I do a meal plan with a patient or when I offer them a meal planning tool, I may be laying out what 1,500 calories for a day looks like. And most of them are very surprised when you're picking healthy foods on how much food you actually get. And I always compare that to, okay, if you were to buy a McDonald's meal that was 1,500 calories, it might be one meal and it's over, whereas a 1,500 calorie meal plan for the day can mean multiple meals with healthy choices. So yes, in a sense, it's calories in, calories out. But again, like you made the point, is it 200 calories of ice cream, which is very easy to do, or is it, a salad with grilled chicken, which is obviously a better choice.
And, it's not, I think that the message is that it's not just all about depriving yourself, because if that's what it's about, we won't get very far in a weight loss, routine here. So how do we balance that deprivation versus I'm feeling satisfied by what I'm eating?
Right. I think I'm not a big proponent of, you can't ever have one specific food or one specific thing. That old saying, moderation is key. It does hold some truth for this. I think if you're making an effort to, eat in a healthful way, exercise, and do all the things that can lead to a healthy lifestyle, there are, times and there is room for, a sugary treat or, a cheat here and there. And it really speaks to how often does this occur. I always have patients kind of look at on the spectrum of, I only do that once in a while. Well, how many once in a whiles are there? And how often is your once in a while? Is it once a month? Is it, 3 times a week? And maybe there's something else that we could substitute. So for instance, I had a patient today tell me that his snacks consist of a candy bar. And I was like, okay, I can kind of see that. Halloween's coming and, candy's on the horizon.
Right.
But I didn't want to tell him, no, you can never have a candy bar. But I did offer him some additional ways that he can maybe satisfy that craving, that sweet, treat. And we looked at different protein bars or trail mixes, things that may have that little bit of sweetness, but can be a healthier choice.
Yeah, I mean, it really is about overall wellness. And when we talk about during this month about women going through treatment for breast cancer, all treatment looks different. There is no longer a one size fits all for breast cancer, which is great because the research has evolved so much. So treatment can vary patient to patient. When we say undergoing treatment, that might be something similar to surgery and radiation, or chemotherapy may be involved. And I usually say to my patients, while you're in active treatment, I do not want you to be concentrating on weight loss. I want you to be thinking about healthy eating, but let's leave the weight loss until we're through this crisis period, and then we can get there.
Yeah.
So one of the questions that I get frequently is soy. What do I do about soy? Am I allowed to have any soy in my diet? Should I have no soy? Can I have it in moderation? What are your feelings? Part one of the question. And then part two is, does it matter if my breast cancer is estrogen receptor positive or negative?
So that is a common question that we get from breast cancer patients. And I think it stems from the fact that soy is estrogen-like in its makeup. So, years ago, patients were told, don't have any soy. And then once you read a food label, you see that there's a lot of soy derivatives in many products, especially packaged foods and processed foods. That wasn't the soy that we were speaking of years back. We were thinking more along the lines of certain types of soy proteins. Now the research has kind of evolved, and we know that it is safe to have whole soy foods within the diet. Usually we recommend up to 2 servings a day, and a whole soy food would be something like edamame or tofu, soy milk. We do shy away from having patients take soy supplements, pills, capsules, powders, those kinds of things, and enjoy soy foods from the whole source.
Another really important question, and it surpasses breast cancer, it's all cancer in general, is, well, I heard I have to avoid all sugar because cancer likes sugar. So I have to cut sugar 100% out of my diet. Is that true?
Well, all of our cells in our body,
You thought I was going to give you
cells,
easy questions.
we all of our body cells, especially our brain cells, run on sugar or glucose. So how do we get that? How do we fuel our bodies? It's through the food we eat. So you'll know that carbohydrate foods, fruits, vegetables, starches, as well as added sugars, so sugar, maple syrup, honey, all of those things are sources of carbohydrate in the diet. It doesn't mean that they're unhealthful because we're, taking those in, and that sugar is, making a tumor grow or, our cancer blossom. What we're coming to find out is it's not so much the actual sugar in our diets, but the excess calories without the nutrition behind it that can lead to things like overweight or obesity or repetitive release of insulin in our bodies that maybe doesn't create such a friendly environment. So we never say you can't have a sweet or you can't have sugar. But again, we look back to how much, how often are you drinking a big coffee in the morning, with 4 sugars in it, or is this just a once in a while treat? We definitely don't want patients to shy away from good sources of sugar or carbohydrate in the diet, like fruits or whole grains, because those have so many other valuable assets to them. When a patient does want to have something sweeter or enjoy a treat, I generally try to have them pair it up with a little bit of protein. And what that does is it helps our bodies process things in a little bit of a more even tone. So we don't get those big insulin spikes, and it's those big excess production of insulin that, maybe doesn't make such a friendly environment. So, again, it goes back to how much, when, how often, and what else are you doing within the rest of your diet?
So you've brought up whole wheat. Another thing that is spoken about is avoiding anything white. What does that really mean and why?
So whiter foods, your basic white slice of bread or things like white rice, those types of foods just aren't as nutritionally rich as a whole grain. So for example, brown rice or quinoa or a whole grain bread. Those whole grains or whole wheat products have a little bit more fiber. They have just more nutrition in them, maybe some phytochemicals that also are helpful substances in our diet that can help our cells stay healthy. So by eating whole grains coupled with lots of fruits and vegetables, we raise the fiber content of our diet, which can help us feel fuller, which can help with weight management. But it also can give us a good array of vitamins, minerals, and overall better nutrition.
And what is, we can eat, and people are on limited budgets, and eating healthy tends to get expensive, especially as we move into organic foods. Can you talk a little bit about organic foods? Number one, what are they? And then, are they really important? Do I have to eat everything organic because I'm going to have to get another job if I need to do that?
Yeah, so organic can be very expensive. You just look at the price of an organic avocado versus non-organic avocado, and it can be pricey. So the recommendation is it is more valuable to eat fruits, vegetables, rather than decide, should I not eat them because I'm only choosing to eat organic, or should I, maybe have a mix of organic and non-organic. It's most important to get those foods in your diet, whether or not they are organic. There are a couple lists out there called, one is called the Clean 15 and one is called the Dirty Dozen. So the Dirty Dozen is a list of the 12 top fruits and vegetables that are most likely to harbor pesticides if, they're usually thinner skinned fruits and vegetables.
Can you tell us offhand what some of them are?
Like strawberries would be on that list, right? As opposed to, like a carrot. Okay. And then the Clean 15 are your list of fruits and vegetables that are less apt to harbor and contain pesticides. The thing with organic is, I think it's a very personal choice, depending on your finances, your overall beliefs. I don't ever tell patients they have to buy things organic, but if they choose to, that's great. And if they can afford to, that's also great. If they're on the fence about what they should or shouldn't do, I kind of refer them to those lists and then let them see, okay, how many foods from the Dirty Dozen do I often choose? And maybe maybe I'll buy strawberries organically, but the other stuff I can buy conventional.
So is there an easy way, beside referring to a list of, as I'm grocery shopping, to think, oh, you know what, here I should buy organic, an apple because I may be eating the skin as opposed to a banana, which I'm peeling? Does that have anything to do with it?
Right.
Is that just an easy way to think about it?
Right. If you're peeling an orange or a banana, or you're cutting a honeydew or a cantaloupe, you're going to, that skin is so thick. So think of things with a thinner skin, berries, for example, apples or something that you do eat the peel on generally. So kind of be mindful of the delicateness of the fruit. Something like a banana is pretty sturdy, right? And so is a honeydew and a cantaloupe. Whereas something like a peach, has a thinner skin, it's going to bruise easily. I think if just as a visual, those would be safer things to, maybe look toward. Another way that you can kind of combat some of these things is have a garden. Then you're in control. Maybe you really like tomatoes, but organic tomatoes are really expensive. So, maybe, dabble in trying to, even if it's just a few pots on your back porch, may help you kind of A, learn a new hobby, and B, do something really healthy that tastes good.
Yeah, and if you have young kids, you can get them involved.
Right.
Something to do together.
Yeah.
Like that. Right. There's always fad diets and they come and they go. And one diet, and I'm not a fan of the word diet. I think it's just about how we eat and it's all in moderation, but is keto diet. What are your thoughts on that?
Well, the ketogenic.
And is it good for short term? Good for long term? Is it a lifestyle that you can buy into?
The ketogenic diet was initially studied and utilized for children with seizures. So it is a very thought out, measured way of eating. The thing that I don't like about the public side of the ketogenic diet is, in order to actually do the ketogenic diet and do it well and do it correct, it should be under medical supervision. You should have a medical doctor driving, that diet prescription, and you should work with a registered dietitian specializing in ketogenic diet. The part of this that I don't favor is people may adapt pieces of the ketogenic diet, which is a largely high fat content, and they may not be doing the whole ketogenic diet per se. So now all they're doing is their normal eating with some ketogenic type foods in there. There's also no concrete evidence that we have yet to say that the ketogenic diet should be used in really most types of cancer. There is research going on, and I think that's exciting. And we'll have to wait and see where the evidence points. But for now, it shouldn't really be used as a widespread mechanism, because that also eliminates a lot of the good foods that we know research supports, helps lower risk of certain cancers.
Yeah, and it's interesting because let's face it, there's not a ton of nutritional research and cancer that's been done out there. One of the areas is looking at a high-fat diet compared to a low-fat diet, and a high-fat diet increases your risk of developing breast cancer. And we know that through a study with tens of thousands of women. So it's interesting to look at the keto diet, which is a high-fat diet, and have this, really almost mainstream in so many people's lives.
Yeah. It's also it's not really easy to implement the diet if you do it correctly. And it's not always palatable. Mm-hmm. I guess modern technology is great for some things, but, so there's a lot of ketogenic kind of products out there. But I don't know if that would achieve the true goal of a ketogenic diet, which is to be in ketosis, or is it just, a little bit of marketing and, I don't usually recommend that diet.
So since you brought it up, really, what is ketosis? Because there are so many diets that talk about being in ketosis and staying in ketosis, and that's how we lose weight. Can you explain that a little bit to us?
I will tell you, I am no expert in the ketogenic diet or in ketosis. But if you look at it in the opposite way, ketosis always isn't a good thing. If you have diabetes, ketosis is something we avoid. So it is truly a metabolic shift that happens when our bodies aren't getting the fuel that we need in the conventional way. So we're taking, proteins and fats and utilizing them as fuel instead of carbohydrate sources. When I said it was complicated, it is complicated because the patients who actually strictly follow a ketogenic diet have other issues that they have to contend with, so not only can it be unpalatable, it can be a lot of the same over and over and over, how many different ways can you eat fat, and get that ratio of fat to carbohydrate. Plus you also end up with, there could be some vitamin deficiencies long-term and also, GI issues. So, I think people don't really recognize it as it is a metabolic disturbance, I guess, when they're saying, oh, I want to do the ketogenic diet because I think I might lose some weight. I would recommend, a good amount of calories, plant-based, and some exercise. I know that doesn't sound appealing and very trendy, but that's what's healthy, and that kind of is what works.
So is it important to avoid meats, red meat? Is that important to avoid?
So probably the most blanketed recommendation for a healthy diet would be what we consider to be a plant-based diet. That doesn't necessarily mean vegetarian or vegan, but it just means looking at the ratio of animal products in your diet to plant products. So we want you to have 2/3 of your diet from plant foods and 1/3 from animal sources. Now, there are specific guidelines for red meat consumption, and red meat would contain things like beef, pork, lamb. The recommendation for that is somewhere between 12 and 18 ounces per week. So,
What does that really mean? Because
when
most of us are not measuring or not weighing our food. So what does it mean?
A quick, easy way to determine how many ounces a piece of meat or chicken or fish is, if you look at the size of the palm of your hand, that's about 3 ounces cooked. So if you're eating 6 times that in a week of red meat, then there's probably some room for improvement.
I don't know. I have a fairly big hand. I don't know.
Well, there is a difference.
More than 3 ounces. You never know.
If you're a 5'2" woman or a 6'2" man, then there might be some differences in the palm.
Right. So, but that really is a big deal. So 2/3 of your intake of food or diet should be plant-based. So how do processed food fit in with that? We are a busy society, without a doubt. We work a lot. People have families that they rush home to. They're helping with homework. COVID hasn't helped any of that. No. What's the role of processed food? How bad is it for us? Is it okay to have in our diet?
So I also think with processed foods, there's varying degrees of processed foods, right? If you look at frozen strawberries, to some degree, they are processed. They are minimally processed, right? We didn't pick it off the vine and eat it. Something was done to it. They were flash frozen. They were clean, flash frozen. But then you look at the other end of the spectrum at, chicken nuggets. That's much more of a processed food. So again, looking at the types of foods that you're eating, how often are you eating a processed food? Is it once in a while? Is it a frozen dinner 4 nights a week? There are ways to combat that, and that is what may take a little bit of effort. Some things like meal planning, making a shopping list when you go to the store and being prepared, and then batch cooking. I'm a big proponent of batch cooking, especially for patients who are in treatment and who may be tired, and it's very difficult for them to, cook something every single night. If you make a nice vegetarian chili or a good vegetable-based soup, and then you can freeze some of it. I even have patients, if you're cooking a batch of brown rice and quinoa, it's okay, make extra, and then you can individually wrap up or store, a half cup serving or 3/4 of a cup, whatever you think you might eat, and actually freeze that. It's already cooked, and then you can just defrost it and throw it on a salad, or you'll have it as a part of your meal. One of the best things that I've ever done was overnight oats. I pretty much Monday through Friday, if I'm working, I'm eating overnight oats, and I make all 5 jars on a Sunday. And the Monday and Friday taste exactly the same to me. And you can really, you've got oats in there, which are a good source of fiber. You can use some nice Greek yogurt, which is good in protein. You can throw a little peanut butter or almond butter in there. You can use a dairy or a non-dairy liquid source, and then whatever fruits you like. So you can really kind of get a good, well-rounded meal. And I do it once, and I've timed it, because every Sunday I say, I don't want to do this. I hate making overnight oats, but it literally takes me 7 minutes to make 5 jars, and then I'm set for the week. So
that's pretty impressive.
Yeah, a little bit of thinking in advance, preparing in advance, and then being ready for the week coming up can be helpful.
So it sounds like planning really is key, in part, in order to balance our busy lives and healthy eating.
Yeah, and I think too, we have, some nice, we have a good selection of food stores around that are a little bit more, natural, where you can, maybe buy a prepared meal or a frozen, piece of salmon or something that's easy and kind of quick. I do batch cooking too, with like grilled chicken, or not grilled, but baked chicken or salmon. And, I'll make a good amount, and I'll kind of cut it up and divide it and freeze it after it's cooked. And then I can just pull it out and throw it on a salad. So you just kind of have to give a little forethought, look for some new recipes. And especially if you have kids, they may really enjoy, learning how to cook or participating in something like that. And it may get them to like foods that maybe they didn't like before.
We have to start them early in healthy eating.
Ew.
So thank you so much. We all hope that you enjoyed this and learned a lot, as I know I did. And please join us every Monday in October for our Nuvance Health Breast Cancer Awareness Month series. Thank you.
Thanks for having me.